came Vidyapit after class 10 in 1978. And I'm currently a consultant psychiatrist for the British Army and an associate dean of the Defense Medical Academy, or Defense Deanery, as we call it. I'm based in south of England, where I live with my son and my wife, who is also a doctor. She's a neurologist. I went to medical school in Calcutta Medical College. Did my first post-graduation from there, MD, and then I went to England, where I did another post-graduation, and I do not want you to ask why. And then I went to America, where I did another residency training and another post-graduation. So I have worked and trained in 3 different countries, and that's what I was talking about, that I've spent half my life in training. But again, I think it was worth it in many ways, because and it gives you a different perspective. So today I'm going to, at the request of Ritesh and his team, they asked me to talk about, something on mental health, and what better topic there is to talk about COVID and impact on. Now, COVID is having an impact on everybody's life in every possible way. And I'm particularly pleased to see that the questions that were sent in advance, that they were the things I hope I will have covered in my talk. But at the end of it, I'm not going to talk on and on. At the end of it, I'll leave plenty time for to discuss any questions or any points you have in mind. Rahul, next slide, please. So all of you are feeling the impact of COVID in various ways, wherever you are. Doesn't matter, Australia, England, India, Japan. Don't know about Japan that much, but I'm sure they're not spared like Vietnam. So the slide, you will see the mortality in UK is about 0.15% of the population. And there are some severe infection. The severe infection not invariably leads to death, but it can. And the more serious the infection is, the more vulnerabilities you have physically. If you are old, if you are overweight, if you have pre-existing medical conditions like hypertension, kidney problem, you are more likely to feel the full brunt of the illness. And of course, this is from the time when we were having the initial unadulterated variants. Now things are changing. And the presentation is changing. Many of you probably would have heard that COVID is not even manifesting as a respiratory condition anymore. I have heard from my own family members, couple of them, a cousin and a niece. They were tested positive for COVID, and they came with only gastric symptoms, diarrhea, bloating, and all those kind of things. And thankfully, they did not develop respiratory symptoms, so they were spared. And they were young, of course, and they were relatively healthy, so they were spared. So that is the physical side of things. The danger that, as I see it, is not only the fear of the physical complications, which is very real, very serious, but it's the restrictions that are imposed either by the government or by yourself, for your own protection of yourself and your family, which is social isolation. Because one thing we know now is that this virus is not transmitted by air. The virus is transmitted, like they call, airborne, and through droplets. So if you are socially distanced, if you're physically distanced, if you take precaution in barriers, then the transmission chance is very rare. That is why some vulnerable people, pre-existing condition, they have been shielding in UK. So, they were not allowed to go out of the house. They are not allowed to meet with anyone from outside. So this was before the vaccine. Now things are changing a little bit. So social isolation, as you see, is the result of lockdown and distancing measures that has been, I think, in my experience, the most significant, impact of the COVID restrictions. And personally, I felt it too. How? So when the COVID first came to England, I have some, first of all, I'm old. And number two, I have some medical conditions which I'll not share with you. But my doctors told me that I need to be one of those protected groups who needs to shield. Shield means you are staying cocooned in your house. You don't meet with anyone. You don't go out. And in our thank you, Rishi, uh, very kind. But and in our country, they even had situation for people who are shielding. So they would call me up and say, "Hey, do you need anything? Do you need your shopping brought to you? Do you need your medicines delivered to you?" Now, I was fortunate that I did not need any of them, but that situation was there, which is not everybody. But at that time, in March, April, when the thing was going on, I felt that I needed to go to work because I have a department to run, of 60 people, troops who look, they were all scared and they were looking at me for, I think they were looking at me for some kind of, leadership and, reassurance. And I did not feel that my health concerns, which I could mitigate by taking precautions, were sufficient for me to, as I inelegantly put it, to hide under the desk. My troops needed to see me, that I'm there. The big guy is there, and big guys got it. And I did that, and it was a risky thing to do, and my doctors were not happy about it. But that's a decision I made after balancing out. So I did not feel it that time. Second wave when it came, and they put restrictions. At that time, my department people told me, said, "Sir, we are good. We are good. Plus, this new variant is more dangerous. You are not vaccinated. I think you should stay at home." So, on their advice, I stayed home in social isolation. My son was in school and he was not allowed to come. My wife is a doctor in a faraway city, and she, deals with, COVID patients and everything else. And she did not want to come home, not only because of the lockdown, but because she did not know if she was carrying the virus. So those 3 months of isolation, although I was allowed to go to shops, I did venture out a little bit. It was quite difficult. So one day, I had to bring one of my staff to bring me some paperwork which could not be PDF. It was like a box of medical notes which they could not PDF. So they came, and I still can remember how elated I was to just see another human being, living, breathing, talking, sitting at a distance with mask on and everything. And that warmth of human contact was so valuable. It was something that was lost, not necessarily, in reality, but many people miss that. And of course, the other thing that we had was the loss of livelihood. So if you are a small business owner, your business is, in people facing, and you are locked down, like the, small farmers or the migrant workers I hear about in India, you could not do that. Now in England, they had a system called furlough. So if you are not allowed to work or not able to work because of the COVID, the government will provide up to 80% of your salary out of the public purse. Now that had been not possible everywhere. And even if it's 80% of the salary, it still stings. And I think people felt that one as well. And of course, nobody knew at that time that how it's going to, how are things going to work out. So they were scared. Will they still have a job? And this is on top of the fear of catching COVID and getting something, bad happen to you. Temporary closure of schools to restrict social interaction. My son was home all of pretty much last summer. So, that was not a bad thing. But, he was doing online class. But teenage boys, even, older people, they need company. Online, Zoom, WhatsApp, Instagram, all of this is very good. But I don't think anybody will claim that this takes away anything from the human contact you have. Just the hanging out, mucking about, not necessarily wrestling, but just being there and being an idiot. That is important, and that they missed. And again, slightly older people, older kids, closure of university campuses. Again, the same thing. You can have all the lessons on the Zoom, but if lessons were to be had only by online, I think people would have never had universities or colleges or schools. So there is something about that. Next slide, please. So that was the problem that people had in the beginning and still continuing, coping with uncertainty. So what do I do? I don't know if I'll have a job. I don't know when my going to be able to see my friends. I don't know when I'm going to be able to go on a holiday. I don't know if I'm even allowed to go to the shop. And that kind of uncertainty just freaks you out, especially when it is added with the other uncertainty of you don't know how bad this situation is going to pan out and the physical complications and the health conditions that are associated with COVID. And I think that was the main thing in my experience, that was the main thing I felt, that nobody knew anything. They were all fighting in the dark, and that makes it harder. Now we are into light, some kind of light now, so we know more. We have vaccines, we have medications, all those things we did not have in the beginning. You know, in the beginning, people did not even know how infectious it is, how lethal it is. Nobody knew anything. Now imagine going into a battlefield without knowing what your enemy is like, what arm, what weapons they have. It's scary. So at that time, our advice was, and it still remains, that focus on the present. Now it is easy for me to say, sitting in my, in my study, slightly, vaccinated and feeling secure. But it is what we should try to do. You can only, you have to start thinking about it so that you start believing it, that you can only do your best with what you have today. Okay. So if you don't have vaccine, then you're sitting here worrying about the vaccine is not going to get you a vaccine. You do what you can, which is, go to the portal, ask for it, whatever you need to do. In my case, I waited patiently for the call for the second vaccine to come. And I have no shame in admitting that if my wife was not agitating me continuously, I probably would not have made the call when they neglected to call me. So when I did call them, they were very apologetic. I said, sorry, doc, I don't know how it happened, but yes, please go. So that's what you can do. Focus on the present. Bring things that are certain back into focus. What are the things you can control? What are the things you know, what you have? That you've got a loving family, that you've got a secure job, that you've got an important job. Those are the things you can control, and you can focus on them rather than focusing on what is not in your hand. And this is the other thing I found important. Talk to people you trust. Now, talk means, if you can do it in person, if you're lucky, fine. If you can't, you can do online. And don't dismiss your concerns as completely out of whack or crazy. And do not judge yourself too harshly. Now, this judge yourself too harshly, this bit, which you will hear, in the coming minutes, and I go on and on about it because it's a very important part of our, coping with it. Self-compassion. And self-compassion means if you are already berating yourself by I can't do this, I'm this, you are not going to get very far with it. But people do it. Why? I'll talk about it in a bit. Next slide, please. So these are the things that I put in 3 slides. So this is when you are in isolation or somehow you cannot go out. You're stuck. Yeah. Now, I say get outside. Now, you're saying, well, I can't go outside. Well, you can go outside somewhere. You're not allowed to hang out in the mall, but you can go out to the garden. You can, still can walk. Even in the harshest of lockdown, I don't know about China. Nobody knows about China. But I think even in the harshest of lockdown, people were allowed to go for exercise and walks at least once a day. Yeah, and then it increased. Number 2, connect with others. It goes without saying. That's what you can do. Structure your day, because you have suddenly, everybody has a structure. Even the 17-year-old, who is recuperating after his school finished, they have a structure. We don't like their structure, but they have a structure. From that, you are into a complete, elastic morass of a situation where there is no structure. What do? You can wake up anytime you want. You can do not have to get shaved or get changed. You can do anything you like. And that is scary. That is scary. Suddenly you think, oh my God, what I'm going to do with all my day. So if you can put some of your own structure into this, saying, whatever you can handle. So I'll do this. I'll wake up, I'll make myself a cup of coffee and then make myself another cup of coffee and another cup of coffee. And then I will get dressed and log onto my computer. And then I will do this much of work. And then I will take this much of break. So you make your own structure. Remember, you are having to do the best with what you got, right? So you do that. Next is exercise. That goes without saying. Travel online. Now, I read that, but travel online means, you can go to places on Instagram, I think, or YouTube. I don't know. But, those are the things where you would want it to go. You can check those out. And that could be your distraction. That could be your, 5 minutes break. And following on from that, use your imagination. So if you had planned a holiday in Thailand, the good bits of Thailand, and you can't go, you can imagine those things. You can put up a picture of the beach you were planning to go to, and there are plenty on the way. And practice acceptance. And that comes with the self-compassion again. So acceptance can mean that you are being very, very harsh, or you can say, I'm in this situation, I'm doing my best, and I am really, really doing my best, and I should continue doing the best for myself and my family. Devise fun activities for your kids. If you won't believe that, my son, who normally I would not see, the sight of until it's lunchtime or dinner time, we did stuff together. We played Monopoly. We played Ludo even. We did all this. I have a huge carom board which I imported many years ago. Which I dusted out of the garage, and we played that. We both suck, but that's okay. We did that. It was a useful, fun thing to do. And remember why staying home is important. So here you are feeling trapped, but you have to go back to why you are trapped there. It's not because some international conspiracy to trap you. It is to keep you safe and other people safe. Does that make sense? Yeah? Great. Next slide, please, Rahul. So the second side of this thing is I feel lonely. So you are not only getting crazy being at home, you are now accepting that you are home, and now you are lonely, isolated, alone, disconnected from family. So those 3 months I'm talking about. When I did not, literally embrace my staff, but, when they came to give me that box of paper and I was so elated, that time I'm talking about. So creative ways of keeping in touch. Well, there's not much creative way. You got WhatsApp, you got Zoom, you got, Instagram and all those kind of things. Rekindle the art of letter writing. I found that was quite interesting. If you can write letters. Yeah. Now, paper letters I was talking about, because it actually, writing emails is good too, but paper letters gives you a different kind of tactile and visual, input into the whole situation, and makes the whole experience a little bit different. Not necessarily better, but different. And the whole idea of taking a piece of paper, writing with a pen, and then folding it and putting in an envelope and putting in a stamp, and those kind of activities, they mean something. Engage with online communities. That we had all sorts of groups. My wife and her family, they even had a WhatsApp group which I did not participate in, but I was hearing about it all the time, that how they started taking up cooking. So and these people, they are rich people and spoiled. They do not cook. They have cooks to cook for them. Now suddenly cooks were not there, so they were cooking, and they were doing not a great job, but they were learning, and they were exchanging those ideas. I cooked this, and of course, they probably overdid because all of them got fat, but that's another matter. So that is something you can also do. Engage with online communities when you're feeling that you are isolated and alone. Help others, and this group knows what it means to help others. I've seen, although I do not talk much about in the WhatsApp group, and I read everything, and I have seen what you guys have done for others. From oxygen concentrator to getting somebody into touch with doctors. All of those things you have done, and I'm sure that made you feel good, and for a moment took you out of that sense of isolation, you know aloneness, and that disconnected from the society situation. Because when you're doing something for others, you actually feel connected. And human beings are I call it, we have a neuronal Wi-Fi. We connect without realizing. Have you noticed that in a movie, people laugh at the same time? All the people laugh at the same time. All the people cry at the same time. All the people at the same time when it's a horror film. How do they do that? I think there is a neuronal Wi-Fi kind of situation going on. So human beings are connected, and I think you can take that connection to a different level. Distract yourself when you are getting bogged down with something. Move away from what you're doing and do something else that you like, that you think is fun, that you have done for fun in the past. Take care of your overall mental health. So if you are having the symptoms, which I'll talk about in a second, recognize them and accept that you are not made of titanium and you can break. And it's okay to break. What is not probably going to be okay, that if you break and don't recognize, and then it breaks so bad that nobody can put you back together. So we all have an obligation, to and it's difficult. Some of the things of course, you know yourself better, so you will know what your symptoms are. But some of the things, the anxiety, the sleep problems, the loss of appetite or the increase of appetite, the increasing desperation, the increasing helplessness, the hopelessness, and that from that comes the worthlessness. That is what you should be looking out for. There was a research in the healthcare, community in many countries, and interestingly, all countries have returned kind of the same percentage. So whether it was Singapore, where the study first happened, or in England, or in America, healthcare professionals, doesn't matter whether they were wearing PPE and doing COVID stuff, healthcare professionals reported a whopping 48% return of anxiety symptoms. 43% reported depression. 53% reported sleeplessness. So this is the kind of figures we're talking about. Now, I don't think it's unique to healthcare professionals. I think we are all susceptible to this. And if we recognize it, we can do something about it. And the last thing I wrote there, as a hopeful note, is that remember, this isn't forever, it will pass. Now, many of you are thinking, well, we've been hearing that since March 2020. It will pass. Yeah, we just don't know when. Next slide, please. So what you can do about your mental health and well-being? Well, first up, the important thing is talk to someone. If you coop everything up inside, you don't tell anyone, and you are in isolation, nobody's going to know. So talk to someone, whether it's online or on the phone or in person. Talk to someone and say how you are feeling, what is bothering you. And remember, accepting that you are finding it tough is not an admission of you are rubbish. That's why human mind is where to go. Yeah, but it doesn't have to be that way. And you need to practice that to believe it. Get moving, which is exercise. Do not just sit and allow your desperation to take over. Yeah, because if you do, the chances are it's not going to go away just like that. It's not going to melt away. You need to do something proactively, and it's difficult to do when you are alone. So reframe negative thoughts. So negative thoughts, we all have negative thoughts. Whenever, who has not had this feeling in their mind that somebody who always, I don't know, maybe I'm the only one who has had this feeling, but I want to share this with you. When you are feeling crap, and I have no elegant way of saying it, when you are not feeling great in yourself, And the same people, say for like Rahul. So I texted Rahul yesterday. Rahul, what Rahul said, I'm cooking. So I wrote back saying, hey, I hope you cooked something nice. And he said, yes, Dada, I did cook khichdi. And then I said, I hope, it's a good, wholesome thing. So we're texting. Now, if I have been talking to Rahul for a long time and he always responds as soon as I write, and then one day he doesn't. Now that could mean 300 different things. Means he's with his boss, he's engaged in something more important, his phone is out of signal, his phone is out of battery, all of those things. He dropped it in the loo, in the toilet. But a mind under siege who is not feeling great will automatically go that, I must have done something, he hates me. You have no way of knowing that. Absolutely no way of knowing it, unless he told you actually in writing that I hate you and I'm not going to answer you. That can happen. But you see where I'm going with this. And as soon as you get that in your head, it's very difficult to shake that off, because now, like a vacuum cleaner, you are going and looking for more evidence that you can pin on Rahul why he hates you. That time he took 5 minutes to answer my text. He said, I'll email you immediately after this call, Dada. And he didn't. He took 5 minutes. I should have picked on that. You see where I'm going with this? So it spirals. And as it spirals, weighs you down, your mind now goes there. I sometimes give the example to my patients that, if you drop water on your floor or your tabletop, wherever it will only go one way, where the slope is. There are no ways about it. All right. So that is what you have to be mindful of. Find hope and contentment within. Again, going back to what you have. Think what you got, what you can do about it, and be thankful for the things you have. Add mindfulness to your day. Now, mindfulness, you will, I put I put a lot of emphasis on mindfulness. I teach mindfulness to my patients and to my students as well. And if we have time, I probably would like to talk a little bit about it toward mindfulness. Express gratitude for what you have. Sever simple sources of joy. Things that, yes, if you had a Lamborghini, it probably will give you joy, but I'm sure joy can be had by other things. Some people will find joy, they could have a Tata Nano, So whatever gives you joy. So I tell my patients, can you do one thing you enjoy a day? One thing, just one thing, even if you have to force yourself. Like what? I said, whatever it worked before. I like to go. I mean, if you say, I like to beat up people, that's the only enjoyment I get. Don't go there. But you know what I mean. I like to go for a walk. That made me happy before. Well, go do it now. I used to cook. Well, do that. It's hard. Yes, I know. That's why I said, do one thing. We're not asking you to do everything. Do one thing a day, even if you have to force yourself. Okay? It helps because you're consciously doing something. Get a daily dose of sunlight. Now, there is no shortage of sunlight for many of you, so make full use of it. In England, we are not so lucky. So we have to take vitamin D extra tablets and, and do our best and pray. But if you can, please do. It does things for you. Okay. And do not ignore thoughts of suicide. If you are so desperate that you are thinking your life is not worth living, or, you'd be better off dead, you know that's not a normal thought. And you have come that far that thought has dropped in your mind. Talk to somebody. Do not ignore it. Now, it might go away if you do certain things, which is again connecting either with the other side of your brain, which is not the hopeless side of the brain, or you connect with other people who will then instill hope and do something. Okay, so that's very important. The 9, I put it at the end because it's not very common, but you must consider that sometimes people descend into such despair that life has not got any meaning for them, and that is dangerous. It is dangerous at best of times, and during these times, it's even worse because you feel you got nobody to talk to. Next, please. So to summarize, how do you cope with fear and anxiety? Control what can be controlled. Pace yourself. Don't think of this as a marathon. And if you just do everything and you are hoping, okay, I've done everything and now it's going to go away. No, it's not. So you have to pace yourself for that. Build up tolerance by doing those small things. Vary your routines. Don't get into a rut. So if you are working from home and sitting in the same spot every day is proving to be a nuisance, try something else. Nobody cares. They can only see the top half of you. You want to wear red socks and pink socks onto different feet. You want to wear, do whatever the hell you want to do. Remember, you are in charge. And this situation has given you very little control on one hand, but a whole bunch of control on the other hand. There are things you can do, you know. And finally, talk to work. If you're finding it hard to get to work or do particular shifts or activities because of anxiety or fear, speak to your manager or a colleague you trust. Okay. Now, I'm not saying that all employers will allow, but I have seen colleagues of mine, doctors, qualified doctors, good doctors even, could not bear to go to work. I can't. I'm going to be dead if I go there. I'm going to catch COVID. This is March, April time. Last year we're talking about. I'm going to get COVID and I'm going to die. No, you're not going to die. If you wear all this PPE, the chance of no, I'm going to die. And they used to come and sit in their cars and talk on the phone and then go away. And as a department manager, sometimes you get annoyed with these kind of people. We all do, and I have no shame in admitting. And one day, one of my captain, junior officer, told me that, Doc, do you realize how lucky you are? I said, yeah, I'm lucky in many ways. He said, well, that you don't have to deal with that anxiety every day. And it hit me. It should have hit me automatically without me being told. But what I'm telling you is that sometimes even the most obvious eludes you because you are under siege, from all sides. All those fears, anxieties, uncertainties are, having a constant go at you. And then it hit me. That's true. Imagine this person who has to live with this fear day in, day out. How hard it must be. So thankfully, I did not say anything to her before, but I reached out proactively rather than her reaching out. I said, hey, what's going on? Is there anything I can do? And she talked about the anxiety she was having, how it is. So we had a conversation. I made some derogations in her working arrangement, and it improved, and she is now, fully back at work, fully, free of the fears and doing what she should have done. Now, I'm not saying she did it because my intervention, but I'm sure the intervention allowed her to empower herself a little bit more. And that is what I was mean. If you fear that you can't speak to your manager because your manager is unsympathetic prick like me, you can find a friend, a colleague you trust, and maybe they can talk to your manager. Maybe they can carve out something, right? But it's important that you don't keep it to yourself because you are yourself by yourself quite a lot in this situation anyway. It's been forced on you. Do not make it worse by reaching where you possibly can. So if I reach to Ritesh, for example, it's a bonus we have, not an impediment. Okay. So it's like, say the God gives, takes things away and then gives, it just balances out. All right, next slide, please. Shubham, how are you doing for time?
Yeah, sorry, Da.
Are we okay for time?
Yeah. Like
okay. The practical things. So one of them, move every day. Try a relaxation technique, whatever works for you. Meditation, music, breathing, whatever. Yoga, whatever. Connect with others, very important, because we can. If this was in 1999 or 1978, the only way we could connect was by going to their house, or making a trunk call. Some of you would not even know what the hell that is, but believe me, it wasn't something nice. Uh, it had benefits. If you are angry at somebody, you could really violently slam the phone down, which is not the same as end call violently. It's not the same. So we missed out on some of those. But and letters, those are the only ways of connecting. But now we have lots of ways. Do it, and take time to reflect and practice self-compassion. So set aside some time for reflection, meditation, and when those critical thoughts come to your mind, as they will, I guarantee you, you consciously fight that by saying, it's okay. It's okay. Yeah. Now, I know when you are under siege, even finding that it's okay is hard. It doesn't give you the opportunity. Okay. There is not a whole bunch of opportunity breach in that wall of negatives. You have to find it, because if you don't look for it, you will not find it. And if you don't find it, you're not going to do something about it. So the trick is to do it consciously, because it will not happen automatically. What will happen automatically is what I told you, like water, it will only go in one direction. Okay. Improve your sleep. Sleep is very important. Now, I know you guys, not you guys, all of us, we have our own sleep routine. Okay. Most of the time it's good. We go to bed at 3 o'clock in the morning and we wake up at, 7. Some people can manage with 4 hours. Some people need more, whatever. But in this situation, because there is a degree of sensory deprivation, because you are stuck inside, your whole routine has changed, your sleep may also be impacted. And of course, sleep is one of the first things that gets impacted in, when people are becoming anxious or depressed. So you got to do some, you can do some really, really simple, clever things that will help your sleep, and I'm sure you know all of it. One of the most important thing I tell patients about sleep hygiene is that stick to a bedtime. You set up your bedtime, whatever the hell it is. 3 o'clock, 4 o'clock in the morning, 12 o'clock, 10 o'clock, doesn't matter what it is, stick to it. Do not use your bed for anything else other than sleep and sexual activities. Okay. So reading a book in the bed, many people do it, and in normal circumstances, fine. But when you're struggling with sleep, that is not a good idea. So you got to get out of it. So I tell my patients, if you can't sleep, watching what's on Facebook is not going to make you sleep. You need to get out of bed, do your Facebook stuff somewhere else, and then go back again when you're ready to sleep. You need to contain you control your caffeine intake. You need to control your alcohol intake. You got to have some discipline in your sleep. Yeah. And then it will improve. It will not improve miraculously overnight, but if you continue to do that, within a few days it will improve, and you will see an impact on your mood and your anxiety level accordingly. Next, please. So I just put it there, and I have never taken a lunch break. I eat at my desk. Sometimes it's not true. I never. Sometimes I go to the officers' mess, with my trainees or my captain, and have lunch there. But most of the time, I eat at my desk, or not eat. Not cool. You are allowed to have a lunch break, and if you take it, I think you should, even when you are working from home. Now you can say that working from home, so my whole day is a lunch break. Well, then you have failed in the first thing I told you, that have a routine. So have a routine, incorporate that lunch break, put your Skype on, I'm off, or I'm on lunch break, or whatever the hell it is, so that people don't disturb you, or you don't feel obligated to be disturbed, and keep to it. That's an important, intervention you can make. Next, please. Any of you heard about long COVID or worried about it?
Heard about long COVID.
Okay,
And
so long COVID is something we are now beginning to see because the acute thing is kind of dying down. So long COVID is basically a similar to chronic fatigue syndrome, a complex disorder that characterized by extreme fatigue that worsens with physical or mental activity. So it's not only that you are, digging a hole in your garden that you're getting. Even mental activity like this can make you tired, literally exhausted. Now, the chronic fatigue syndrome or myalgic encephalitis, it's got all sorts of names. It was not recognized as a legitimate, condition. Some doctors still don't believe in it. However, I think science is coming out now that it is actually quite real. Now, these are the symptoms that has been associated with long COVID. Now, we do not know how long or who will get it. Some initial studies say that it's healthcare professionals are getting it more. Don't know why. Some studies are saying women are getting it more. Nobody knows why. Some people are saying women of middle age are getting it more. Again, nobody has done any research because it's so early. So these are the symptoms that can be there. Fatigue, continuous fatigue. Now you all know that if you had flu, right? Many of you had flus, influenza, the viral fevers and those kind of things. There is a thing about post-viral fatigue. So after flu, when your thing goes, you immediately do not spring back to how you were before you got it. There'll be a few days of and then you recover. But this one is actually slightly more protracted than this. Okay, that fatigue continues throughout the day, and how long? My sister-in-law who had mild COVID, for her it lasted 3 weeks. For 3 weeks, she could not even climb stairs, and she was not even violently ill. Okay, now she is woman and middle-aged and kind. Yeah, so that makes sense now. But I hope she's not listening. Uh, then you have shortness of breath or difficulty breathing, cough that can continue, joint pain, chest pain, muscle pain, or headache. Those kind of pain symptoms like myalgic things that can happen. Memory, concentration, or sleep problems. Heart rate going up, loss of smell or taste. In COVID it can happen quite a lot. Some people recover. My cousin recovered. As soon as he recovered from COVID, his smell test came back. I know people who have been 3 months who have not. So not all of these symptoms will happen in one person, but a combination can happen. And nobody knows how long it will go on for. And nobody knows what to do about it, except, symptomatic. So if you have fever, continuous fever, if you have got dizziness when you stand, you do the things you can. So if you are dizzy when you just get up, you sit yourself down slowly, those kind of things you can do. And like I said, these symptoms worsen after physical or mental activities. Now, like chronic fatigue syndrome. So, yeah. And as I said, it's still early. Nobody knows what it means. Nobody knows what the treatment is. Nobody knows where it goes. So it's all a little bit up in the air. But this is something to be mindful of. And perhaps if it continues, if you see any of those symptoms continuing after you have recovered from the immediate physical effects of COVID, maybe it's something you can keep an eye on. Maybe you can seek professional help, although I do not know at this point what that help will entail. Next, please, Rahul. So you heard me talk about mindfulness a couple of times. So mindfulness, as you probably know more about mindfulness than I do. Mindfulness practices are an ancient knowledge, came from Buddhist philosophy combined with modern knowledge of psychology and psychopathology. A practice or cultivation of a way of being with and relating to one's mind and body. It's not a panacea for everything. It's not a religious thing. Some of people, secular people, they say, oh, it's a Buddhist crap. No, it's not. It was founded on Buddhist principles. but it doesn't mean anything that only Buddhists can do it, or only Hindus can do it, or only these people can do it. It's not a quick fix, but with a regular practice, people will feel more resilient during difficult times. So what I say to people, my patients and my students, is that it is something you have to practice. It's not something you are born with. Okay? Interestingly, you probably will agree with me that you were not born with very much. God did not, give you very much when you were born. He gave you the capacity to scream, to suck, and to poo and pee. Those are the three things you came with. Everything else you do, you have learned. So this is another thing you have to learn. And when you learn it, initially it's hard. It's hard like learning to ride the bike, when you fell and thought, perhaps like me, that you are never going to do it. Or learning to drive. If you're in India, you probably don't drive, got drivers. But when you learn to drive, I could not figure out how can anyone ever manage the clutch and the gear change. Absolutely impossible. I used to not literally, but almost cry. It cannot be done. It can be done. I've been doing it for now, 26 years. And I do it without even realizing. That's what I'm talking about. I learned it. It was hard, but once I learned it, you don't even realize. So what are the things you can do? Next slide, please, Rahul. So this is the problem that we are dealing with. So distressing thoughts that are common in psychiatric conditions, the painful thoughts, fear-inducing thoughts, shame-inducing thoughts. Yeah, they come. Why they come? That is another thing that has not been figured out yet. Why they come? Why do these things come? Well, we know that they come because something in the present reminds us of something in the past. So that's why, and then it magnifies as you grow older, that, gathers momentum, it magnifies. And brain responds to these thoughts as threats. Now, as soon as brain, that's how nature programmed us. So you have a threat and you immediately go on DEFCON 1. So you got to do. So brain does what? Your cortisol, your steroid hormones, your adrenaline, all of those things come and you become more anxious and distressed. And that is mediated by a center in the brain called amygdala. Okay, amygdala is your friend in many ways, but it is not your friend when you are on, when it's sending you into overdrive. It's only sending you to overdrive because the brain cannot recognize these thoughts are not the same threat as somebody running after you with a machete. It kind of equates in the same thing. So what you need to do is you need to train your brain to go to another area of the brain. Next slide, please. So you need to train your brain to go to another center of your brain called the insula, which calms things down. Now, unfortunately, you cannot invoke the two centers, insula and amygdala, at the same time. It's like you can't have, you can't put a car in two gears at the same time, or and somebody once said, what happens if I, press brake and accelerator at the same time? And jokingly they said you take a screenshot, but no, you can't do two things at the same time. Okay, so the amygdala will act with all those heightened emotions, and you have to somehow consciously, and with practice it becomes subconscious, automatic even, you go invoke the insula, which calms things down. That is the trick. That's all there is to it. Now there are very many ways of doing it, and you can do that by meditation. You can do it by just being some body scan, all those kind of things. But this is what it basically, I say, it's about the whole thing: noting and letting go. Okay, easier said than done. Okay, so you note what is going on. So amygdala is doing its amygdala stuff, right? Sending you to all sorts of frenzy. You note those. Don't react, you note. You note the reactions, the worry, because when the amygdala is going crazy, what do you get? You get everything that goes with worry, anxiety, pounding heart, dark thoughts, all of them. Noting feelings. How do you feel at that time? And then noting thoughts, negative thoughts, and evaluation. Especially, I'm no good at mindfulness. Well, nobody is no good at mindfulness in the beginning. You become good at it, and then the ability to let go of that and focus on to something else. Because I said, because if you do two things, if you do one, you cannot do the other, right? And you do this over and over again without judgment. So when I give this talk, normally I say, I have a 10-second, I tell my audience that, for 10 seconds, you do something. Just focus on the present, anything, 10 seconds, all I ask. And I promise you that 80% of those people in those 10 seconds will have a thought, boom, come into. Well, they're trying not to, right? It will come. And the trick is not to go ballistic at yourself, saying, God damn, I can't even do it for 10 seconds. You got to say, okay, let's start again. 5 seconds are gone. Okay, fine, do it again. You got time. So that is what mindfulness is about. Staying in the moment. Next slide, please. There may not be a next slide. Okay, well, maybe that is a good indication for me to stop now. So yes, so you consciously train your mind to stay on the present. Now, there are many tricks people do it, and sometimes my patients say, well, this is some crazy Buddhist shit, right? No, you do not have to sit on the floor cross-legged with a windy on your forehead. It's my practice. You can do it at your desk. You can do it while you are walking. You can do all sorts of things. A couple of things I tell patients to do is to try cooking. I promise you, try cooking. And I dare you, I double dare you. See how far you go with, having thoughts. Nope. Do gardening. Even the most, innocuous of jobs, weeding. You try that. And try to have, thoughts crowding. No, it doesn't. I don't know why it doesn't, but it doesn't. Listening to music, because, the two senses you employ. So you have to employ the other senses, the 5 senses God has given you. Use any of those, but focus on that. So breathing, or, focusing on your sole of the foot, or, just imagine how your breath is going in and out, whatever you do, but stay on that rather than allowing those thoughts to come. And when they come, you banish them gently with compassion and try again. And you do this over and over again, and you will become a master. And then you will automatically, unconsciously, subconsciously, you will go there rather than freaking out, which is now done your default automatic. Okay, that's all you're doing. You're reprogramming, retraining yourself. Another thing I say that sometimes, for the absolute beginners, in my office, sometimes they come and say, oh, why am I going to do mindfulness for? I said, you don't have to do anything. Just focus something. Just start by looking at all the red things you can find in your, in your immediate vicinity. Just do that. You can do that. So red book, red door, red wall, another red book, another red. No, that's not even red. That's like kind of pink. Well, it will be red. You do that, and then suddenly you are in the present. Yeah. While you are doing that, you cannot have those things coming in your head. Yeah. And it will try to break through. And it's not, no, I'm doing red now. Thank you. And you go back, and you do this over and over again, and your brain gets trained to use the insula rather than defaulting on the amygdala, if that makes any sense. All right, I think, as I said, the slide ended. I think this is a good time to stop. And I will shut up now. And I also have, I told you it's a bad, old computer. My battery is showing 11%, so I have to do something about that. If you would indulge me a few seconds, I will get my charger. And
Yeah, yeah.
I don't know.
Brother.
Yeah.
Yeah, get your charger and all. Thanks a lot for a very informative session. So, all the attendees here. Meanwhile, while you can arrange for the charger, Dada, so all other audiences, if you have any direct question to ask to Dr. Sameer Sarkar, then please unmute yourself and put those questions forward. We have already got few questions on
Yeah.
the Google form, but what I got to know from the session itself that it was more largely covered in the session itself. All those I have got only like four direct questions in the Google form I can see. So I guess that has been covered. But still, if you have anything specifically or something more intricate in detail to be asked over here, we can dedicate around a few good minutes over there. Because since we started this session 15 minutes late, so for this question answer session, we can dedicate another 15 minutes or so for that. So, and then I will leave the platform open for all the RKM alumni to hang out and share. But as the session said, that we should keep engaging ourselves in like conversing and meeting people online. And just let our thought flow as it has to be. So, so anyone, most welcome to us while Samita is arranging the charger for himself.
One more second.
Yeah, it's okay, Dada. Take your time. But it was nice and very informative one. I mean, thank you. More or less, like what it happens. All the points that some Dr. Sameer Sarkar has like told us over here is kind of we consciously or subconsciously know it from inside or from outside sources or from the articles or anything we consume. But yeah, it's very good that someone specifically comes up and talks about it and gives a relatable analogy, the way he has treated his patients, where he is working. He's like bringing out some relatable examples out of it and making us understand in a better way. That that's exactly is important. That helps a lot.
Right. I'm back.
Yeah. So yeah, anyone who have a question, please don't shy away. It's about the mental health issues. The very
Yeah.
first thing that we have to break is that own barrier to ask it
Uh,
shamelessly. Ask our
Shubham,
question.
Shubham, hello. Can you hear me?
Hi. Yes, yes.
Yeah, Sameer, I'm Dr. Sen, Biswajit Sen.
Hi.
I'm from 1975. I passed out from the
1970.
college.
I thought
Yeah,
I recognized the name. Yes.
yeah. Acha, I just wanted to know what is the impact of all these lockdowns and other things of COVID-19 for younger children? Younger means really young.
Really
So,
little. That's
say
a very
class
good
three.
question.
So if you
Yeah.
can,
I think that's a very good question. You know what, Dr. Sen? I have always commented on, every patient I see. I don't see that many patients these days because I've got, other nonsense to do. But, whenever I see a patient and I ask them that, you got kids? And they said, yeah, I got kids. How are your kids doing? Yeah, they're doing all right. So it's not based on any research, but my own, experience. I have found that kids have actually done very well. Now, you would expect that they would completely freak out. But that goes on to show that how adaptable as humans we are, and all those baggages we were talking about, that clouds, the kids have not got that. They are, their mind is freer. You know, they are freer. They are not settled yet. You know, so as we grow older, we develop our own ways, and and get fixed in our ways. And Rahul. Rahul is leaving, so that's good to see Rahul. But yeah, I thought I thought children do very well, little children especially. Yes, I mean, you have to explain to them that why they are not allowed to, do whatever the hell they were doing before. But once you explain them, you know, and they had taken to this online class and online, physical exercise so good, it was almost amazing. I don't know what if you had any other experience, because if you had kids, but my kid is, big, and I mean, he's 17, but even he took it to even he took it rather well, you know, and only recently, when again I don't put any particular emphasis on that. Only recently, when I stopped him from going to an illegal gathering, then he's was a bit upset and said, "Oh, it's been so hard." But I did not say anything hard about it, in his entire time he was with me. So I think, to answer your question, my personal experience, what I gathered is that children have actually tolerated this much better than we have, and came out relatively unscathed. Of course, that is a huge generalization. Now, if the children had predisposing conditions or their situation was already bad, they would have reacted differently. But most of them, by a huge percentage, they have done rather well and tolerated this better than grown-ups. Thank you. Anybody else?
Sujita,
I can add
I
to
come
that.
in? Yeah, yeah. Can I come in? Can you hear me? Yeah.
Hi, we can.
Yes, Dada, we can hear you.
Yeah. What I saw, absolutely right. In children, like in my house, I have a mate and his driver with me, and his son is around 6 or 7 year old. And the way he has coped up, in fact, it was amazing. Now I am also a teacher, professor. The way the teacher teaches the young student is a same to be believed. They completed the whole year on online, and they kind of passed the course and they enjoyed it. My only apprehension is, in India, most of them have not gone physical classes. So once they go back to classes, some of the symptoms might uncover. That is my anticipation as a pediatrician. The kind of stress or tension, whatever they have till now, they have kind of controlled and all. You might see a little bit of more, that coming into the forefront in some children, I believe, when they join the physical classes. Now, especially in India, those who are in class 10, class 12, they're unduly stressed about exams not happening and all those things. And we actually don't know, because we are not examining them, we're not taking a survey, what is happening. My son is also in class 18-year-old. He was lucky to get, he passed 12 last year only. I think he's lucky. Though for the last 1 year, 3-4 months, he has not ventured out of his house. It's very difficult for them. So yes, we have to wait and see. But yes, by and large, they have done reasonably well. In my hospital, we don't get that many children with mental health issues. Thank you.
Yeah. Rahul, shall we ask those four questions that were asked before? Let's go by one. The first one, you sent it to me. Now, the people whoever brothers and who asked this question, first of all, the first question is how to find motivation for the grind, especially after the fallout for the pandemic, when the first thought that came to your head is it even worth it? Well, have I answered to an extent your question? If I haven't, I'm afraid I don't have any any great clever answer for that. How do you find the motivation? Well, we have to dig inside and and find reasons. And you have to, one of the things, why are we doing it? You have to go back to that basic question. So healthcare workers who have been particularly affected, when I gave the talk to my the trainees in our deanery, one of the things that we talked about was, it's doctors and nurses and all the healthcare professionals, they kind of have this superiority complex, almost delusional, thinking that they are beyond everything. They are made of this. And it doesn't take that long for them to come from here to boom. Yeah. So rather than having that cliff edge, I say to them that, look, you don't have to go that high that you are titanium. You just consider yourself to be like normal people made of clay. And then it will be that you don't put your expectations so high, so you will not fall that much. And you got to ask yourself that question, why am I doing this? Not doing work during the COVID, but why am I in healthcare for? What brought me? And if you have that reflection in your head, that capacity to reflect in your head, and invoke that reflection in good times, that I think will help your motivation. Because if you say that, okay, you know what, I'm here for the wrong reasons, I don't even know, after all these years, I don't even know why I went to medicine. I know why. My father forced me to, but you know, but even my quieter moments, I think, even if my father put a gun to my head, if I did not want to do it at some level, he probably wouldn't have got me that far. So you got to ask yourself why you're doing this, and that you have to go back to that and increase, and build on that. That's all I can say. I'm sorry if it didn't make much sense.
No, no, it's perfectly okay. That's right. Yeah.
The next question is, what are the things a person and an institution can do to help people who are suffering from mental health issues of their own? Now, answer to that, I would say, is that as individuals, you have some responsibilities. You can ask, for help, and many, organized sector work. There are helps available. But the organizations can do things, and one of the things I said to organizations is that, first of all, if you are not aware that it can impact, then your policies would not reflect that. So organizations can do that. So all of you who are in managerial roles or policymakers, if you keep in mind that this is real, this is not, you know, this is not some people just being weak. Because you remember that the doctor friend I was talking about, my colleague who could not come to work and was sitting in her car.
Yeah.
She's a fantastic doctor. Yeah. But if you don't acknowledge that people can break and you have no way of knowing how they are going to react, but they are all vulnerable. So you have to have that awareness. And then you put all the supportive measures, which is that allowing them to talk, allowing him to negotiate their working conditions better, not conditions, working conditions, how many shifts they're going to do. If you can deploy them in somewhere else, not everybody needs to be doing cardiac surgery every day. If there's no cardiac surgery happening, because of COVID, maybe you can deploy that cardiac surgeon into doing something else, maybe by supporting others, all sorts of things you can do. But none of that you will be able to do if you are not cognizant of the fact that this is something that can happen and affect people. So as managers, that's your responsibility, and then put in place. And always, I found it useful that as a manager or as a head of the department, if you put in some measures, you explain that. You don't just send it in a memo and let them figure out why. So from 21st of June in the UK, when the regulations are changing, my people are working from home at the moment. We're not seeing patients face to face that much unless they are very risky. But I have been telling them for the last 4 weeks that please have this conversation in your head with your loved ones, that when this is over, how you're going to come back. Are you going to come back full-time office work, full-time working from home, or a combination of both, or what that combination will look like? Are you going to see patients face to face, or are you going to stay on video? All of those conversations you have, and come to me with a workable solution, or what you think is a workable solution. If it's reasonable, I will authorize that every time. But if it's completely unreasonable, no, I'm not going to set foot in the department ever again. I quite like, sitting at my home, in my pajamas and do little work, and that's probably unreasonable. So whatever you reasonable, so if you can explain to your folks why you're doing something, then that becomes easier, and give them opportunities to ask questions, and also, but at the center of all of it is to acknowledge that this is something very real and affects people in various ways, and they are human being. Everybody's trying their best. There are some people who are taking full advantage of this. I know, there are, but they are a minority rather than most. Most are doing their best, and that is what I think we keep in mind.
Yes, I think there is a question from Abhishek. Abhishek, would you go?
Hi
Please.
everyone. My question is that I think the most problematic thing here is the uncertainty regarding the COVID. So how do we cope up with the uncertainty?
Well, the uncertainty by definition is something you don't know or can't expect. So if you go back to that slide in the beginning, there is no magic answer. But what you can do is try to control the things that are under your control. So how you deal with yourself, how you run your day, how you plot your day, what do you do for yourself, those things are not uncertain. Those are in your hand. Now they are, compared to the big uncertainty that you are facing, it will seem small. I can only control what I eat. Well, I can't even control what I eat because, the shops are closed. But the thing is, if you go down that route, it's not going to help. So you have to curb out your own certainties that are in your control to mitigate against the uncertainties. And you have these small wins, as I call them, and it may not look like big, but you clock up all these small wins and suddenly together it becomes something, half decent, if that makes any sense.
So basically, I think we have to divert from all those uncertainties and keep in mind what we can do.
Yes, be mindful of what is there, but don't focus there, but focus on what is certain in your life, and what you can control, and just mitigate that, and you build up these small wins, and then 5%, my 5% rule, 5%. This will do 5%. This will do 5%. 5%. Come on, man. I mean, what is it? You kidding me? So I said, no. Don't get upset about the 5%. Think about all the 5% you can get, and suddenly it's together 25%. Not looking that bad, is it? So, yeah, makes sense.
Yeah, very much.
Great.
As if I can add, like the actions are, if the actions are not in our control, our reactions are well in control to
Yes.
ourselves.
Yes. And another thing I say, it is a cliche, but it's a useful cliche, is that feelings are not facts.
Yes, true.
Okay?
It's just some illusion our mind is creating it for ourselves.
And mind does that, because we have programmed our mind that way. I don't know how it was, 5,000 years ago, but I mean, we want to know everything. I mean, what the hell you want to know everything for? What do you care that Zaire has a flood? I mean, I don't even know what Zaire is, but I read that Zaire has a flood and say, oh, how many people died in that flood? Who? Well, what do you care? Care about the situation you have in front of you. Like I said, I want to care, and I know what my neighbor is doing. Yeah, I mean, it's good. I don't want to know what 4 doors down they are doing. I don't really care. But if your mind is going that you have to know what's going on 4 doors down, you got a problem. You got to focus it back to, yourself and perhaps your neighbor. All right. Shall we go back to those 2 more written questions?
Yeah, please.
Sure.
Very quickly we can just.
So the panic and apprehensions leading to irritation and agitated mindset of many. What's the best way to deal? Again, the panic is real. We talked about the apprehensions, the uncertainty and what is going to happen. That's the most one, the anxiety, leading to irritation and agitated mindset of many. The irritability comes from the helplessness, and the helplessness comes from being attacked, or feeling that you are being attacked from various quarters. Yeah, and that translates as irritability, because why do people get irritated? Do people get irritated just like that? Some people do, I'm sure, but most of the people get irritated when they feel powerless to do something about it. Yeah, and some of the things are doubtless irritating. if somebody cuts you in the traffic, and somebody is being an absolute idiot, they are irritating. But like Shubham said, we can control what we do about that, rather, because we can't control that other person, right? So if they're a bad driver and they're going to drive like, an idiot, they are going to do that. You can't pull them out and say, hey, why are you driving like, that's not going to go very far. It's not going to go well. But what you can do is you can do something about how you react to that. Now that becomes difficult when you are feeling under attack and powerless. So at that point, consciously, you try to get the control back. And this is what I can control, which is what I am going to do. So the driver came from nowhere and went this. You can, on your horn, you can put your window down and shout and give them, all sorts of, hand gestures. Or you could just say to yourself in your mind, it's an idiot. What can you do? But that choice is yours. But that choice gets decimated, diluted, so to speak, if you are feeling already under attack. That is why depressed people are, from a depressed state of mind, they become more agitated, more irritable. But that is something, again, you can do. Mindfulness does help. The deep breathing technique, we say, whatever it takes, you just have to take control of the things you are in control of. Okay?
Yeah.
And the last written question I have here is, how do we keep ourselves motivated, especially when we are in essential services work?
Yeah, this is helpful for all the frontline warriors we have.
Yeah. Good. He's not going to have lunch after Shomai. Sorry, my wife came and announced that my son, who just woke up at 12:05, is not going to have breakfast, but is wanting lunch at 1 p.m. So I said, no, ain't gonna happen. It's not going to happen. So either you have breakfast or you starve. So essential workers, well, that's essential work, right? Being a parent is essential work. And the answer to your question, cheekily, and I say, is the same. That know that it's not going to last forever. Is that enough motivational? No, but that's all you got. Okay, and go back to the things you can control and make those small wins, very small wins, and know that it's not going to last forever. My son is not going to be 18 forever. He's going to leave for university, thankfully or hopefully, and then I will not have to deal with this nonsense of waking up at 12:05. But having said that, I did that when I was that age, and I'm sure his father will, he will do that when he is a father, and that's the cycle of life, and that's what you do. So it's not going to last forever. If that's, I don't know whoever asked that question, brother, but I hope it made some sense.
Yeah.
Great.
Excellent. Any more?
That was excellent, Dada.
Excellent.
That's all.
And in fact, it was lovely hearing you out. In fact, we couldn't take hold of the time. It just passed by and we didn't realize it's already 4:30 now. Rather, in fact, 35 minutes past 4. So another one last question, if any. Otherwise, we'll have to wrap it up, and maybe we'll have you soon. In fact, there was a request if you can take a session on mindfulness. So obviously, Ritesh Da and the backend team would look to it and how we can best accommodate that session again.
I'll be glad to do it. It's just, I've got a big project in, which is taking a lot of my time. But again, anything I can do, I will. I'll be glad to keep talking, and then, it may not be at a time that you want, but we'll work something out.
Yeah.
Great, Dada.
Sure.
Ritesh Da, anything that you would like to add?
Thanks, Sameerda, and thanks to all the audience for taking out time to discuss things. And I think particularly we never heard about mental health and psychiatry when we are in Vidyapit or in school. But increasingly, we realize that this is one of the things we talk about. There is no shame in it. In fact, I have taken some advice from psychiatrists in the past, and based on those personal experience, I can say that a good psychiatrist can be an asset when it adds to your clear thinking and clear your thoughts. So any one of us in our family or friends, we think that he or she may need some help, and I think we should help them understand that this is an important part of their life and go for it. And thanks to Rahul, Rakesh, Rahul Shubham, and the Praktani Adda team for arranging all this so that we can come all together, talk about it. Apart from the talk on psychiatry or previous sessions, it's good to see different people coming together and discussing things. And some old batchmates, like Sameerda said, "Oh, Biswajit, I can remember you." And then Biswajit is saying to someone else, "Oh, I like Biswajit is a classmate of my uncle who passed out from the same batch from Vidyapit, and he never knew that he's my uncle." So these things also which develop over the time period and softly. And the soft part is, after a few years, we will realize it has brought us closer, and it has added social capital to Vidyapit and our society. So thanks everyone for all the support, and hopefully we will meet in another session, which is going to be exciting, which will announce. It is something to do with COVID again, but it's going to be how one of our alumni has helped UK government form policies based on his models. So how the COVID, infections, etc. I'm not the right person, but he's Anandip Mandal, based in UK, and we will take over that session next. Thank you very much.
Thanks.
So we can officially call this session end over here, official one, but we can stop the recording, Rahul.
No, we'll have to close the session as well.
Okay.
Okay.
I was just in